Thalassemia is a genetic blood-borne disease. It is inherited from father and mother to children, and it affects our body severely because red blood cell is essential for our body. It usually carries oxygen from lung alveoli to other parts of the body, and because of that, if there is lack of red blood cell or hemoglobin, patient can suffer from severe anemia. Usually, symptoms of thalassemia depends on types of thalassemia. Thalassemia carriers are usually asymptomatic. They don't express any type of symptoms other than mild anemia or low hemoglobin. But in case of thalassemia major, this is a fatal blood disorder. These children can suffer from very severe anemia, recurrent infection, and sometimes the children can be died from thalassemia major if they are not properly blood transfused. And usually there is no early sign of thalassemia other than anemia and recurrent infection. Usually there is no early sign of thalassemia other than anemia and recurrent infection. Yes, thalassemia is preventable. So whole world we are working on this prevention and awareness of thalassemia. If we find any thalassemia carrier, like in case of male, so before marriage, they definitely go to know for the thalassemic status of their partner. And if there is a marriage happens between two thalassemia carriers, a baby can born, and there is chance of 25% in case of one child to be born with thalassemia major. There are lots of treatment of thalassemia nowadays, but it also depends on types of thalassemia. In case of thalassemia minor, there is no treatment is required, but sometimes these patients can come with severe anemia. Then we have to identify, is there any other cause of anemia, because this thalassemia trait patient usually they don't require treatment. So thalassemia major patient, usually two types of treatment option. One is regular blood transfusion, another is bone marrow transplantation. So if we do the regular blood transfusion, we have to start from very early stage of their life when they appear anemic, because if we don't blood transfusion properly, these patients can be growth retarded and they can suffer from recurrent infection like respiratory tract infection and diarrhea. So we have to be very concerned about the treatment of thalassemia, and we have to select patients for bone marrow transplantation also. We can do allogenic bone marrow transplantation for this disease, and this is the only one curative option for these thalassemia major patients. There is another experimental treatment for thalassemia, that is gene therapy, but this is still under clinical trial. I have already told you what are the treatment option of thalassemia. One is regular blood transfusion, but not only blood transfusion is important in case of thalassemia patient. We have to ensure safe blood transfusion of thalassemia patient, because from blood transfusion they can suffer from chronic infection like hepatitis B, hepatitis C and HIV, and we have to ensure there is no blood-borne infection can be transmitted to these babies through the unsafe blood transfusion. So we have to definitely ensure this safe blood transfusion for these thalassemia major patients. There is another grave complication of thalassemia major patient from blood transfusion, that is iron overload. This patient usually died from very early stage of their diseases for this iron overload. Usually from blood transfusion, they can develop iron overload, and this iron can be deposited in heart, liver, even in some gland like pituitary gland. So from these patients, they develop very low growth hormone and they can suffer from growth retardation, and from the iron overload of heart they can be died because they can easily develop a heart failure. And hepatic iron overload or iron overload in liver, that is also a grave complication of unsafe blood transfusion in case of thalassemia patient.